Hello guys, good evening everyone. Good evening nursing student, LPN student, RN student. This is Dr. Louine, number one instructor for your Nclex review. Now, if you need a review in your own language, you want to pass Nclex with good tactic, technique, strategy, how to pass your Nclex. The way you see I'm doing the video, this is nothing compare it to into the way I teach my student. It's fun. There's no problem. I do it fun. The times pass and you don't even realize that. Now, the number to call Dr. Louine, if you speak any of those languages, if you speak Creole, Haitian people, come on. Now, if you speak Spanish, come on, call me. If you only speak English, what I'm doing the video right now in English right now, call me at 561-319-4660. Now, if you need a full review, you need a 3-month review or a 3-month, 1-week review to pass your NCLEX for 2022. Just like everybody else, this week I have one student who passed NCLEX just like that. She said, Dr. Louine, you are the best of the best. Because I passed NCLEX after 7 times. And that was Creole Pali, Creole Comprend review. She passed it in her own and on her own language. Now, if you look watching the videos, I do the videos for you in English only. I want to encourage other community to know who is Dr. Louine. I have the license as a nurse, and I have also license, and I am a doctor from Dominican Republic. So now, I have the secret of Nclex because not only I am a doctor, I am a nurse, and I take the Nclex exam in this country. And I'm saying that if you want me to put more videos for you, encourage me, call me, share the videos, subscribe. Let me say it again. Before I start, I'm asking you guys, go to my YouTube channel, subscribe, click on that bell button if you need to know when I put any videos for you. Now, the number to call me again is 561-319-4660. Now, tonight I'm gonna be speaking about the muscle relaxant medications. You need to know that for your NCLEX. Let me say it again. You need to know the muscle relaxant medications, the anti-spasm medications, the musculoskeletal medication. You need to know the hyperreflexia medication. You need to know the muscle spasm medication for NCLEX. Now let me talk about 2 medications that's only in your exam as an NCLEX tip questions. The very first one is Baclofen, and the second one is Flexeril. There is other medication. There is carbon dioxide. There is other medication. And for Baclofen, the other name for Baclofen, when patient is taking Baclofens, you need to know Baclofen is another type of, anti-spasm or muscle relaxant. Now, the second medication is Flexeril. Flex. Look at the word when they give you the question in English. You need to pay attention. Sometimes they give you a medication, you don't even know what it is. You have no clue what it is. But pay attention, break it down, nursing student, my nursing student. break the content, break the name down, and you would have the answer. You would know the side effect of this medication, guys. Now, for Flexeril, Flexeril, it's cyclobenzaprine. Now, those two medication for Nclex, what should you know in your Nclex exam? I'm gonna be telling you exactly the keywords, the key side effect, and what is the most important teaching as a nurse you need to do. This is what I'm gonna be. Before I continue this video, guys, I'm asking you, please, again, subscribe and share the videos. Now, the other name for the common brand name for Baclofen is Laowisol or Ozobax. Ozobax at Ozobax or Laowisol. Those are muscle spasm medication or muscle relaxer medication. Don't forget it. Don't forget it for your exam. Now the question is, there is different brand name for this medication. They call it Baclofen, they call it Laowisol, they call it Ozobax. So now for Flexeril, the other name is cyclobenzaprine. So now, what should you know about those two medications? For Baclofen, like I said, it's a spasm medication. When you have spasm, the back or from accident, any accident, any trauma, any injuries, they're gonna give you Baclofen. The doctor gonna order a Baclofen for you. Now, they may order a Flexeril also. Those two are muscle relaxing. Now, take note. Now, if you have spasm from a skeletal muscle, or you have a muscle clonus, you have rigidity, you have pain caused. Some pain, you may have some pain that caused by accident or more multiple sclerosis. Hey, if you have multiple sclerosis, MS, if you have spinal cord injury, if you have any spasticity, guys, the doctor will give you a Baclofen medication. Now, Flexeril basically the same thing. Flexeril they use it also as a short-term relief of muscle spasm, because it's a muscle spasm, also acute pain or skeletal condition, same thing. You don't need to worry about them. Both medication, they use it in both conditions, but except Flexeril, when they give you Flexeril, guys, Flexeril is they use it most of the time in short-term relief of muscle spasm problem. Now, the question is, what is the side effect of each medication, guys? I'm telling you that tonight, so I'm teaching you exactly what should you know for your Nclex exam. Now, for Baclofen, the reason when I understand the side effect, if you look at the word Baclofen, this is a lower back spasm. This is a lower back pain. If you look at back pain or back spasm in your back, I understand what's gonna happen in Nclex. Because most of the time, guys, like I said, when they give you disease, when they give you medication, break it down. Baclofen. So now, the side effect, the most important side effect you need to know for your Nclex exam, take note, is fatigue. Because if I have back pain, back problem, I'm gonna have fatigue. I'm gonna be tired. I'm gonna have dizziness. You're gonna have drowsiness. That's common sense. If you're taking a medication for pain, back pain, lower back pain, common sense. That's why they call it Baclofen. Now you're gonna have muscle weakness. You're gonna be weak in your muscle. You're gonna have headache problem. You may have nausea, vomiting. So guys, those painkiller medication, underline this one. constipation problem. Underline it. Common sense. Whenever it is a period, whenever it's a painkiller, if it's a muscle relaxing, constipation problem. Pay attention to this one. Whenever you taking those medications, you're gonna be confused because those medications, the fact that you're gonna be dizzy, Georgie, you're gonna be confused. Sometimes you forgot to take this medication and you're gonna like driving, you're gonna do something and you forgot about that. You're gonna get confused. And this medication is too crazy. You're gonna lower your blood pressure, right down, lower your blood pressure, and you're gonna have insomnia problem. Underlying insomnia, underlying dizziness, drowsiness, underlying constipation, and underlying urinary retention. When you're taking those medications, those anti-spasm medication, guys, you always gonna have urinary retention, respiratory depression. Those medications are like daughter medication. Those medications suppress your signs symptoms. Those medications get you down. Those medications get you crazy low. So therefore, respiratory depression, urinary retention. Remember it. Now, the next question you need to know about Baclofen for Nclex. How do you teach your client? The next question. How should you teach the client as a nurse? Now, if the client is having dizziness, drowsiness, that makes sense. Low blood pressure, that makes sense. If they tell me what should I tell my client in Nclex, there's a lot of things I need to tell them. But the most important thing I need to teach my client as a nurse, I'm gonna teach my client, don't drive, don't drink, and don't lift heavy stuff. Don't do that. If you work in Walmart, in a warehouse, be careful. If you work in a company where they build motors, engines, don't do that. If you go into a party, don't go there. If you're drinking alcohol, don't do that. If you're drinking beers, don't do that. If you smoke, don't do that. So guys, as a nurse, you need to tell your client exactly what not to do after taking this medication. Do not forget it. Now, the question is, not only that, if you're taking this medication, you make sure the patient is safe. Because the question is safety. As a nurse, your job is safety. Safety issues. Remember that. Remember this side effect for your Nclex exam. Now for Flexeril, Dr. Rene, what about Flexeril? Basically the same thing, same side effect. Remember I said where do you use the Flexeril? Now the side effect for Flexeril is basically the same thing. It's a muscle relaxer. But the thing that with Flexeril, you're gonna basically have more like dry mouth. If you're talking to that, you're gonna have dry mouth. Now I know the patient should drink a lot of fluid, common sense. While I'm teaching, if I'm gonna teach my client, I need to tell them to drink a lot of fluid because the side effect tells me this is how you pass Nclex. When you have the side effect of the medication, you teach your client. Listen to that. You always teach your client based on the side effect lessons to them. Remember that. If the patient is drowsiness, safety. If the patient is dry mouth, water, fluid, common sense. Now, the patient gonna have dry mouth, fatigue, dizziness, drowsiness, headache, same thing. Weakness. But the thing I realized about Flexeril, the patient gonna have acid reflux, GERD, gastroesophagus reflux disease, GERD. Now, this medication, not only that, it's gonna have abdominal pain when you take it. So now, not only that, all those medications, the fact that you're gonna have drowsy, dizziness, low blood pressure, safety. Now, not with Flexeril, you're gonna have vision problem. Vision problem. Basically, you have the same side effect. The difference is you have acid reflux, try mouth more, and an abdominal pain. Remember it. Now, the question, Dr. Rene, how do I teach Flexeril patient? How do I teach my patient if it's on Flexeril? Same thing. That's not a big difference. But the thing I'm going to tell them, this patient with on Flexeril, drink more fluid, a lot of fluid. Drink fluid. Same thing with Baclofen, fluid. High fiber, because risk of constipation. Safety, patient is weak, patient is drowsy. Dizziness problem. Safety. Common sense. Nclex require common sense to pass it. And a good instructor who can teach you exactly the point, the key point. The instructors who know the secret of Nclex, guys. Now, what should I teach my client on the Flexeril? Same thing. Don't drink, don't drive, and don't lift heavy stuff. Don't do that. Don't lift heavy stuff. Remember you have dizziness. Remember you have drowsiness problem. Remember your blood pressure is low. Relax. Sit down to the edge. Relax before you do anything. If you get out of the bed, if you get out of the chair, do it slowly. Nclex depression, do it slowly. Take precaution. Make sure you have somebody with you, CNA or UAP with you to take you to the bathroom. Everything you're gonna do it slowly. Don't go to a party. Don't drink alcohol. Don't drive to go to a party. Don't drive. You need to pay attention when they give you discussion. They're gonna give you scenarios, guys. Now the Flexeril, guys. The thing about Flexeril, people, they may have hallucination when you're taking those medication because that's opioid. That's muscle spasm medication. That's muscle relaxant medication. You may have hallucination. You see like zombie. You see, thing that you don't see nothing. That's hallucination problem. You may have seizures problem. So suddenly, if you stop it, you're gonna be in big trouble. Don't stop. Don't stop your medication suddenly. Because if you stop it, you're gonna be in big trouble. Nclex situation. What is the patient is doing that is your concern? What is the patient doing? And what the thing the patient is doing that's my concern right now. If you stop it abruptly, if you stop it suddenly, you may develop seizure problem. You may develop hallucinations problem. That's for Baclofen. But for Flexeril, if you do that, you're gonna have problem. You may have headache, nausea. So now, you may have hallucination problem also. Be careful with this one. Now, the patient, if you're taking Flexeril, beside of that, you may have the same problem. You're confused. You may have stroke problem, heart attack, seizure. Same thing. Seizure, heart attack, stroke. So guys, when you're taking those medications, you need to pay attention which side effect is your priority in Nclex. Remember that. With Flexeril, you may develop stroke. With Flexeril, you may develop heart attack. With Flexeril, you may develop seizure. While with Baclofen, if you stop it suddenly, for example, that may cause you seizure or an hallucination problem. Those are the most important things you need to know about those two medications, guys. What do they use them for? I will recap for you. The side effect of each medication and the teaching as a nurse you should give your patient. Thank you so much, guys. This is Dr. Rene, #1 instructor. I took the time after teaching tonight. I'm so tired, guys, but I took the time to do a very quick video which is 19 knock on 20 minutes for you. If I am encouraging you by putting videos for you guys, what about you? Encourage me, guys. Please subscribe, share my videos, and talk about Dr. Renee review. And the number to call Dr. Renee if you need the full review, if you need the package to study, and the number is 561-319-4660. The package is in English. If you speak English, you don't have the schedule doesn't not good for you. This is what you need. The package. I have quick fact and core content. Thank you so much. Encourage me so I can continue with the good job. See you for another video. Good luck to you. Good luck, guys. Love you all.